Welcome to the June 29th edition of PAR Tuesday News Review, your timely source of news that is important to IDA providers in our community.
The Pennsylvania State Legislature and Administration completed their budget negotiations last Friday night. PAR is working our way through the budget. Our preliminary review shows that the legislature agreed with the administration deciding how to spend the funds generated by the 10% FMAP bump. Pennsylvania submitted its plan to spend the funds generated by the 10% HCBS-specific FMAP bump to CMS on June 14th. The plan is vague on specifically how the IDA portion of the funds generated by the bump are proposed to be spent. The plan includes 9 proposed investment areas: increased access to HCBS, HCBS provider payment rate and benefit enhancements, supplies and equipment, workforce support, caregiver support, support to improve functional capability of persons with disabilities, transition support, mental health and substance use disorders, support state HCBS capacity building and LTSS rebalancing reform. PAR is waiting to see CMS's response and public comments on Pennsylvania's initial spending plan for the bump. CMS's response is due July 14th and public comments are due July 6th. It appears also that the legislature did not allocate additional COVID-19 relief funding for IDA providers out of the over $7 billion fund from the American Recovery Plan. The case of mortality study was submitted for publication today. The study sample included over 600,000 people with IDA and on Medicaid in states representing a third of the population of the United States. The results showed that IDA providers were keeping people with IDA safer from COVID-19 infection than the general population, and that people with IDA were over twice as likely as the general population to die if they acquire COVID-19. Please remember to follow PAR on Facebook and Twitter, to check out, like, share our new advocacy videos and information. Please be sure to tag Governor Wolf and your state legislators on any postings.
Thank you for tuning into PAR TNR. Stay safe, everyone, and we'll see you next week.